to see me in a hospital environment where he had control. He had a team to back him up.
Well, did you go to the hospital for a specific purpose?
I don't understand that.
After that, did you go to a hospital?
Yes.
Okay.
Yes, I saw him in his office, and I went into the hospital for the procedure itself.
And what procedure was that?
Started off as an angiogram.
Okay. And then how did it proceed from there?
He actually had to do some work and put in some stents.
Okay. How many stents were put in?
I'm not exactly sure. The first procedure, I believe it was 2 or 3 stents.
And do you know which hospital this was that you were treated at?
Yes, Desert Springs.
Tell me about the procedure. Tell us how it went. Were you knocked out? Did you observe the procedure?
I'm allergic to iodine, so it started off with Dr. Murray providing me a prescription to help me keep from having an allergic reaction to the iodine. Once I got into the facility, they actually did their portion of the procedure, putting in IVs and so forth. They also gave me Benadryl to help with the allergic reaction. I was wheeled into a room with the machinery. Dr. Murray came in with his team, and the procedure started.
All right. Were you awake during the procedure?
Yes.
You were?
Yes.
Do you recall being sedated?
Slightly.
Okay. You were not?
Due to the Benadryl.
Okay. Did you receive any other sedation that you know of?
I don't know of any other sedation at that time. I know I was given a local, I believe, in the leg, so they can do the procedure.
You just remember being awake, though, during the procedure?
Correct.
All right. And you observed, can you explain where Dr. Murray ran this catheter through? What part of your body?
From the groin area and a major artery up through your major arteries up into your heart area.
And you were watching this on the screen while this was going on?
Correct, yes.
At any point, were you confused about what was happening? Did you know what was happening to you?
Never had it before, so I was real concerned watching the heart monitor, making sure it was still beating. But Dr. Murray stopped and asked me if I was okay and if everything was going well for me, and yes, it was.
How was the procedure? Did it resolve your chest pains?
It did resolve the chest pains.
And after the procedure, was that it, or was there more procedures required?
I had a procedure 1 month later. Same thing, stents.
Was this scheduled?
Yes.
Okay. Well, tell us how you got to do that a month later.
The first procedure, if I recall right, there was an area in one of my arteries that Dr. Murray was concerned with being very thin, and I believe that the Desert Springs Hospital at the time didn't have the correct instruments to take care of that. So I was scheduled to go to another hospital a month later and ended up going back to Desert Springs Hospital once they got that equipment in.
Did Dr. Murray explain to you that's why he was not doing it on that date?
Correct. Yes, he was very worried about blowing the wall of my artery out.
Okay. Now, if I were to ask you, Mr. Guest, whether or not Dr. Murray was a reckless doctor, or whether he has care and treats patients with care and caution, would you have an opinion about that?
Yes, sir, I would.
What would that opinion be?
That man sitting there is the best doctor I've ever seen. He also explains everything he's going to do. He makes sure you're okay during the procedure. During the procedure, after the procedure, he's actually called me at home on a weekend and asked me how I was doing. And he's a great guy. I mean, he follows up with everything, makes sure everything's explained.
Thank you, Mr. Guest. Appreciate it. Pass the witness.
Mr. Chernoff, thank you. Cross-examination by the people. Mr. Walgren.
Thank you, Your Honor.
Thank you.
Good morning, sir.
Good morning.
You know Gary Cossey, correct?
Yes, sir.
Did you travel out here with him?
I did not, sir.
Okay. You've done media interviews with him.
I have done one interview at CNN.
Who else was a guest on that show as far as Dr. Murray's patients?
Dennis and Ruby.
Dennis and Ruby, you know them on a first-name basis?
Yes, sir.
Okay. And that's Dennis Hicks and Ruby Mosley, is it?
Correct.
Okay. You guys have all kind of become friends?
As we meet, yes.
Okay. Now, you indicated when you received, again, all your treatment from Dr. Murray was for a heart condition, correct?
Correct.
And it took place in a hospital because it was important to Conrad Murray to have, quote, a team to back him up.
Correct.
And of course, when this procedure took place in a hospital, the team was there as well as the heart monitors and the necessary medical equipment, correct?
Correct.
And I don't mean to be flip, I mean this in all seriousness. Dr. Murray never gave you propofol in your bedroom, did he?
No, sir.
And wouldn't you agree? Is that a correct statement that Conrad Murray never gave you propofol in your bedroom?
Correct.
And wouldn't you agree that the level of care Dr. Murray gave you with a whole entire team to back him up in a hospital with the medical equipment, wouldn't you believe that every patient deserves that level of care? Would you agree with that statement?
Yes, sir, I do believe that that statement is true, but I
Thank you.
also believe that
Thank you. You've answered the question. Every patient deserves that level of care, correct?
Yes, sir. Am
Thank
I
you.
not-
The answer to the question.
Thank you.
Why?
Just a moment. Redirect?
Yes, Judge, thank you. Why? You were going to explain.
I said a team because that isn't a hospital environment. He provides service in his own office, great care in his office. He makes sure you're doing fine.
And Mr. Guest, that was literally a procedure you were getting at the hospital, is that right?
That is correct.
Okay. It's an operation.
Yes, sir.
All right. Did CNN pay you for your interview?
No, sir.
Why did you do it?
I believe that Dr. Murray is not getting a fair shake. I believe he needs support, and I appreciate his kindness, his caring, and I'm alive today because of that man.
Okay, thank you, Mr. Guest.
Chernoff, thank you. Recross, Mr. Walgren?
And Mr. Guest, nothing would change your mind about Dr. Murray, correct?
No, sir.
That's a correct statement?
That is correct.
Thank you, Mr. Guest.
Mr. Walgren, thank you. We redirect, Mr. Chernoff?
No, Judge, thank you.
May Mr. Guest be excused, Mr. Chernoff?
Yes, Judge, thank you.
Mr. Walgren?
Yes, please, Your Honor.
Mr. Guest, I want to thank you for your testimony, sir. Please don't discuss your testimony or the facts of the case with any other witness until we finish the trial, and you may step down and leave, sir.
Thank you, sir.